This video features 4 presentations by SEAMS Nutrition researchers at the ANH Academy Week on June 30th, 2021. The first presentation provides evidence and insights on the costs of multisectoral nutrition interventions in Bangladesh, Malawi, and Nepal that applied the SEAMS Nutrition Common Approach. The second presentation provides evidence on the total incremental cost of implementing a scalable community-based preschool meal program for early childhood development in Malawi. The third presentation provides a financial expenditure analysis of a multi-sector nutrition program across multiple districts in Nepal and the economic costs incurred by volunteers and beneficiaries through participation in the project. The last presentation summarizes a systematic review conducted to assess the range of terminology and methodological approaches used to value the benefits of nutrition-specific and nutrition-sensitive interventions.
Good afternoon and a good evening to many of you. We're thrilled that you can join us today for this research session on cost and cost effectiveness of agriculture, nutrition, and health interventions. Today, we'll be having 5 presentations. I'm going to ask Chris, if you wouldn't mind sharing your screen, so as I'm speaking, we can write. Thank you. So we are having 5 presentations today.
Today, I'm representing the SEAMS Nutrition team, including collaborators from the University of Washington, Helen Keller International, and the International Food Policy Research Institute, led by Dr. Carol Levin. I'm going to start our session by briefly describing a common approach to the measurement of costs and benefits of multi-sector nutrition programs. And I'm going to start to compare results from the application of that common approach across interventions from 3 different countries. So we believe that evidence generated by economic evaluation of multi-sector nutrition programs will be absolutely critical to moving our field forward and promoting investment in essential and effective programs, especially in lower resource settings. We also believe that this evidence is currently very much underdeveloped. Multi-sector nutrition sensitive actions are essential to achieving the 2025 World Health Assembly targets for nutrition and the Sustainable Development Goals. However, decision-making around implementation of multi-sector nutrition programs must be supported by appropriate cost and affordability information so that only the most effective and cost-efficient interventions to promote food systems are implemented. Unfortunately, evidence on program costs and benefits is lacking. There's little evidence of the cost effectiveness of multi-sector and integrated approaches to improve nutrition in general. And what is available, critical interventions or cost and affordability data associated with critical interventions are missing. For example, cost and cost effectiveness of marketing and pricing healthy foods and creating demand for healthy foods. Moreover, the transparency and standardization of methods has been poor, resulting in a lack of comparability across studies. However, there's been a recent surge of calls for integration of cost effectiveness and benefit cost estimates with impact evaluations and a lot of promise for the field moving forward. So SEAMS Nutrition, or Strengthening Economic Evaluation for Multi-Sector Strategies for Nutrition, was developed in response to this need for higher quality data. It's a collaboration between a lot of folks that you'll see on the bottom, funded by the Bill and Melinda Gates Foundation. It seeks to define the most appropriate and standardized methods for measuring cost and cost effectiveness of integrated multi-sector nutrition strategies and programs, and then to apply that approach in a series of programs in several low-income countries. Did I go backwards? Okay, so we've set about developing this common approach. The common approach builds from and aligns to existing guidance for standardized methods for costing and economic evaluation, including the Global Health Cost Consortium reference case, the Harvard reference case for benefit cost analysis, and the IDSI reference case for economic evaluation. In the first stage, the idea is to map your complex intervention to a typology of multi-sector nutrition interventions to promote an apples-to-apples comparison across complex and very different programs. In the second stage, to map the impact pathway for that program and identify individual cost drivers, benefits, activities and inputs along the impact pathway, then to use and appropriately adapt the standardized cost data, a set of cost data collection tools, and to actually collect cost data alongside an impact evaluation, and then finally to compare costs and benefits. So I'll just briefly introduce the idea of mapping a complex intervention to a standardized set of intervention typologies, and to think about mapping your interventions to a program impact pathway or pathways of effect. Most large programs do have an established program impact pathway or logic model that describes how they plan to get from their activities to their measurable outcomes and impact. We like the idea of mapping this program impact pathway onto a standardized set of impact pathways for or standardized typology of nutrition interventions to promote the comparability of what you're talking about in terms of complex multi-sector nutrition programs. So here's a highly simplified version of a program impact pathway to show how this can be done. And what we've done is we've broken out the activities into 3 buckets: activities related to increasing demand for nutritious food, increasing supply of nutritious food, so those are the agriculture activities, and then underlying enabling environment activities, which make the intersection of those previous 2 activities more effective. These activities also increase the affordability of food and reduce the burden of infectious disease and or acute malnutrition. So we've been developing this common approach and applying it in 6 different countries with 6 different programs supported by our partners in Nepal, Burkina Faso, Kenya, Bangladesh, and Malawi. And I'm going to talk about 3 projects, 2 of which you're going to hear in much more detail in a second. One is the Nutrition Embedded Evaluation Program Impact Evaluation in Malawi. The second is the Targeting and Realigning Agriculture to Improve Nutrition, or TRAIN, in Bangladesh. And then Suaahara II in Nepal. So these are very different and interventions with different levels of complexity and different scales of impact. The NEPI, or Nutrition Embedded Evaluation Program Impact Evaluation in Malawi, is supported by Save the Children, and it leveraged Malawi's national network of community-based childcare centers, or preschools, to provide households with young children with agricultural inputs and nutrition behavior change communication. You'll hear a lot more about that from Aisha. Targeting and Realigning Agriculture to Improve Nutrition, or TRAIN, is an ongoing maternal and child health and nutrition behavior change communication strategy that's integrated with an agricultural credit program aiming to improve production diversity and income generation in Bangladesh. And Suaahara II is a large-scale multi-sector nutrition program supported by USAID and implemented by Helen Keller International in collaboration with Nepal's government, reaching over half of the country. You'll learn more about Suaahara II from Sagun Casey. So we've applied the SEAMS Nutrition Common Approach to analyze cost data from each of these programs and generate comparable estimates. Each study took a societal perspective, at least, meaning that we wanted to include costs incurred by implementers as well as costs incurred by community and government. We also wanted to understand the costs required to put each program into place, which we call startup cost, or the cost to keep each program running, or the recurrent cost. We analyzed financial data. We also micro-costed using qualitative data to understand out-of-pocket and opportunity costs by program participants and partners. There were, of course, variations. In Bangladesh, we produced costs for each additional intervention component, and in Nepal, we produced different costs for individual districts across diverse geographies. So the common approach allows us to break down costs by input and activity and other ways to disaggregate cost in order to identify cost drivers. Here we see cost estimates for these 3 programs by input. Like many programs, the largest cost driver by input here are personnel time, and the second is, and travel is also a major cost driver. We can also break down cost by activity. For TRAIN and Suaahara, the most expensive activities were the household visits for behavior change. NEPI, however, devoted almost half of its cost to training, while the next most expensive activity was community events, again, related to behavior change. And finally, we can actually break down costs by the pathway of intended effect of the intervention components. For all 3 programs, the largest cost driver were activities related to increasing demand for nutritious food, so again, behavior change. activities related to increasing supply of nutritious foods, and to improve the enabling environment for nutrition were less expensive. So we believe this common approach has a number of advantages used appropriately. Am I out of time? Oh, thank you. So these estimates produced using this common approach are directly comparable across complex programs, and they're directly actionable and can help inform stakeholder decision-making. Especially the ability to disaggregate cost drivers by input and activity will help improve program efficiency. And we have a set of generic tools available to guide the entirety of your cost study, which should help lower the bar for everyone to think about integrating costing into evaluations of multi-sector nutrition programs. Thank you so much.
I happened to work on this intervention while I was working for Save the Children in Malawi. Picking up from what Chris has said, I'll be presenting on the costing and scaling up of NIP, which was a community-based integrated agriculture, nutrition, and early childhood development intervention that was implemented in Malawi. As a background, as an introduction, community-based preschool meals can provide an effective platform for implementing integrated agriculture and nutrition programs. However, as we know, there is little evidence on the cost, but as well as on the cost efficiency of such interventions. Here, we present to you the evidence from such an intervention that attempted to answer the following questions. One, can preschool meals provide a platform to scale up interventions to improve diets as well as nutrition? The second question that we're trying to answer is, can these synergies from combining different sectors lead to gains in cost effectiveness? Again, this was briefly touched on by Chris. So what I'm just going to highlight here is that this was a community-based childcare center, or preschools as they're known in Malawi, that utilized this platform to reach the preschoolers aged between the ages 3 to 5 years old, their younger siblings, as well as parents. And this was reaching them with two main things: trainings in diets, nutrition, as well as WASH-related activities. But also they were provided with agricultural farm inputs. And the main aim of NIP was really to change the behaviors that were related to the diets as well as the agricultural production. This was a one-year intervention, and it was implemented in Zomba. Okay, now back to the methods. And again, Chris touched briefly on this. So what I'll just highlight is that for NIP, we applied the SIMS nutrition framework retrospectively. And again, in order for us to assess the financial as well as the economic costs of the NIP intervention, which included costs of community contributions as well as the beneficiary time. SIMS, as have been highlighted by Chris, is actually a standardized framework. So what it allowed us to do was to map the activities to the framework as well as standardized cost categories. We also applied a mixed methods approach, which was used to measure and allocate the cost for the program activities and inputs using financial expenditure data and microcosting. To estimate the financial costs, we collected program level expenditures from administrative records, which were coded by input, as well as activity, using standardized categories that Chris touched on earlier. We also conducted in-depth preschool as well as community surveys, and this was periodically between October of 2015 when we conducted our baseline and 2017 when we concluded the NIP impact evaluation. And again, this was to gather the data on resource quantities and utilize time allocation data from a household survey to track the beneficiary opportunity costs. Now, what did we find? As you can see on this slide, we actually have cost by input category as well as cost by activity category. And that's pretty much one of the cool things or the important aspects of the SIMS approach, in that it allows us to break down our cost by activity, as well as identify the cost drivers by different program components. So on my left here, we're looking at the cost by input category. And again, this is something that Chris touched on. Like many programs or this kind of interventions, the bulk of the NEP cost was personnel, which is about 38%. And because we had provided farm inputs, we also see that the supplies, this again, including those farm inputs such as seeds, came up about 21%, and to be specific, the agriculture supplies were about 2%. Again, this highlights that this was actually a core component of the NEP program, being an agriculture and nutrition integrated intervention. On my right there, we see the cost by activity category. And again, what we can see there is that training was actually the largest cost driver at almost half of all the program costs. So that's about 48%. But we also see that there are other main cost drivers. And to be specific, we have school meals provision, which are about 19%. And again, for this intervention, we had to rely on the community to provide these meals. And this aspect highlights the importance of community contributions in such programs. The other last two main cost drivers were monitoring and evaluation at about 12%, and establishing or running community groups. So again, because we're using a center-based platform, we had to rely on not only establishing parenting groups, but also ensuring that they were running throughout the intervention and post-intervention. And the last pie chart there, we're looking at the NEP startup as well as the current recurrent costs. Looking at the startup, we see that they made up almost 25%, which is about a quarter of all the costs. And I guess as expected, the majority of the costs, which is about 75%, was for running the intervention. Here, we present the results of the cost analysis, focusing on the cost efficiency. We see that the overall cost estimate, this is the total annualized cost of the program, was about $200,000 US. All this translates into about $160 per child, $41 per beneficiary, and $219 per household. So, what's our takeaway? This is the first study to provide evidence on the total incremental cost of implementing an agriculture and nutrition intervention through an early childhood development platform. The mapping of this cost to program activities highlights the drivers of cost, which is important for program implementers. This is mainly program implementers that are interested in monitoring program costs, as well as increasing efficiencies, in that it helps them to understand which activities are the cost drivers, but as well as identifying the economies of scale. Now, showing how the program activities are aligned to value chain typologies could also aid program implementers in decision-making around future program design. Based on the success of the NEP model, the Malawi government, in partnership with World Bank, is scaling up this intervention to about 13 districts across Malawi. They're targeting children under 5, and the main objective of the program is to actually improve the coverage as well as the utilization of early childhood development services with focus on nutrition, stimulation, and early learning. And as I said, they're targeting under 5 children. Also, what is interesting to note is that Zomba district, where we implemented NEP, was actually one of the districts that is benefiting from the scale up. To summarize, what are we doing with the Scale Up program that the government of Malawi is doing? We're collecting cost data for the nation Scale Up so that we're able to explore the economic cost of implementation at scale. Again, looking at the two programs, as already highlighted, NEP was from small scale, but also NGO based, as opposed to the government scale up, which is at large scale, but also funded by the government. So comparing the two, it also helps us to see, the fidelity in our assessments. And lastly, in addition to looking at this, the activities will help us generate the critical country level information that we need on the cost for planning and scaling up of nutrition sensitive interventions. And in addition, those also contribute critically needed empirical evidence on the costs, working across the sectors for scaling up nutrition efforts, for supporting financial projections for multi-sectoral strategies to improve nutrition and health outcomes. Thank you. That is the end of my presentation.
I work at Helen Keller International on M&E. Today, I'm representing the SIMS Nutrition Project team to share some preliminary results on costing of Suaahara II, a multi-sector nutrition program in Nepal. I'll be introducing the Suaahara project. I'll briefly explain the study design, and I'll present some early estimates of financial and economic cost. Suaahara II is a multi-sector nutrition program supported by US aid. It aims to improve the nutritional status of women and children in 1,000-day period by improving maternal and child dietary diversity and reduce child stunting. Suaahara has designed interventions on nutrition, health, ag, governance, and focuses on the improvement of health and nutrition behavior, gender equity, social inclusion, and public-private partnership. Now, the key Suaahara interventions include counseling and household level and community events, use of mass media, and capacity building of healthcare workers and community volunteers. The program reaches over 900,000 households with around 1.5 million women and young children across 42 of 77 districts of Nepal. Costing and economic evaluation of Suaahara program is a part of SIMS Nutrition Project funded by the Gates Foundation with the collaborative effort of the partners you can see in the slides below. SIMS project has developed the standardized method for measuring cost and cost effectiveness of the integrated nutrition programs to apply this common approach framework to the large-scale multi-sector nutrition programs to estimate the cost and benefits. So following the SIMS common approach, we aligned the Suaahara program to the SIMS typology. This mapping actually enables to normalize highly complicated program pathways into a standard comparable model, grouping the intervention into standard buckets that you can see here in the left. Moving forward, we define the possible set of inputs for these interventions and potential costs that are required to deliver these inputs. And as the last step, we select from a series of outputs and outcomes that we're concerned of. And that's how we mapped Suaahara into the standard SIMS typology. Moving into the costing exercise, we are collecting data on financial and economic cost. For the financial cost, it includes the annualized program expenditure in terms of salaries, supplies, vehicle transport charges, infrastructure, etc. And for the economic costing, data on the value of resources provided by the participants, including the beneficiaries, in terms of out-of-pocket expenses and opportunity or cost of time is collected. So the study purposefully sampled 4 districts, considering their involvement in Suaahara evaluation to align the results. 1 rural and 1 urban municipality is selected from within the district, and 1 ward is selected from each of those municipalities. For economic costing, a comprehensive qualitative study is executed, sampling various cadre at center, district, and municipal level with staffs, frontline workers, government partners, healthcare workers, village model farms, and 1,000-day beneficiaries. And to estimate the economic cost, we triangulate between the qualitative interviews, work plans, and observations, estimating the opportunity cost in time and out-of-pocket expenses associated with participating in Suaahara activities for these beneficiaries, staffs, and other stakeholders. For financial costing, the expenditure data is collected from national consortium partners and district level implementation partners. financial expenditure data is entered and modeled in the Excel-based tool. And then for the final step, cost effectiveness and cost efficiency of the program is generated by dividing the overall cost estimate by the cost per beneficiary reached. And eventually, net benefits will be computed once the result from Suaahara impact evaluation is available. So far, we have completed qualitative data collection of 3 districts. We couldn't reach the 4th district due to COVID situation. We're trying to get some interviews done there virtually. Till date, overall, we have completed 150 interviews. Hence, the finding that we are presenting right now is not final and only preliminary indications. So to estimate the economic cost of participating in Suaahara, we first need to understand how many people of different types are actually participating in Suaahara activities. And for each of those types, what is the value of their time? And we estimate that using the Motley shadow ways. And here's an example of how we move from our interview data to the cost estimate. We use interview data, for example, to calculate how much time beneficiaries are spending in community events and health mothers group, and how much out-of-pocket expense they are spending in these activities. We multiply activity time by ways. We add that total to the out-of-pocket expense and sum across all different activities to estimate the total monthly economic cost of that type of participant. Now, summarizing total annual economic cost for each district, by activity type, we see that the primary drivers of cost are community events and household visits. By cadre, we see that beneficiaries are primary contributors, followed by the female community health volunteers. So what this suggests is that Suaahara program is really benefiting from a lot of investment from the community. Summarizing the financial cost, as expected, the major portion, about 70% of the cost is salary and then travel. And by activity, again, community events are the most expensive ones. So these are very early results. We still need to complete qualitative data collection of the 4th district, include the national financial expense into these results, and generate the overall cost estimate. And finally, cost effectiveness and the benefit cost results will be generated once the Suaahara impact evaluation data is available. And we're expecting to have the final results by the end of next year. We believe that the evidence generated from this study will be very crucial in designing and planning effective and efficient multi-sector programs and interventions. Thank you.
Today, on behalf of my co-authors from a recent systematic review titled Measurement of Benefits and Economic Evaluations of Nutrition Interventions in Low and Middle Income Countries. Before we get started, let's define some technical terms. We defined benefits in this analysis as any tangible or intangible impact or outcome of a multisectoral nutrition intervention which has value to individuals, households, and communities in low and middle income countries. Cost effectiveness analysis is a type of economic analysis that compares the costs of an intervention to one benefit at a time in a cost effectiveness ratio. Cost utility analysis compares costs to potentially multiple health-related outcomes in terms of utility measures, which are related to satisfaction or lack thereof experienced in different health states. An example of these outcomes are disability-adjusted life years, or DALYs. Benefit cost analysis compares costs to potentially multiple intervention benefits which have been monetized so that you can compare the monetary value of benefits to intervention costs and see which is larger. This review aimed to characterize the types of nutrition-specific and nutrition-sensitive interventions that have been included in recent economic evaluations. We assess the range of terminology and methodological approaches used to value the benefits coming from these interventions. Studies were included that were published since 2010 in English and assessed one of the 78 intervention types included in the UN REACH Compendium of Actions for Nutrition. Studies had to report an economic ratio, in other words, a cost effectiveness, cost utility, or benefit cost ratio, and they had to include at least one nutrition-related benefit, such as improved nutrition status, improvement in food security, dietary diversity, etc. A total of 2,794 studies were screened and 93 studies met all inclusion criteria. Only 8 studies evaluated multi-sectoral programs where beneficiaries received interventions from more than one sector. The most evaluations were conducted in the health sector at 43% of total studies. For the various sectors, there were a few common interventions included in economic evaluations. For example, health interventions were primarily related to a management of acute malnutrition or zinc supplementation. Food and agriculture interventions were primarily mass fortification or biofortification. Social protection studies dealt with food vouchers and unconditional cash transfers. And WASH programs evaluated were mainly household water treatment and storage or sanitation access. Across the various sectors, there was considerable variation in what type of economic evaluation was used. For example, among WASH studies, benefit cost analyses were more common than cost effectiveness analyses, and no cost utility analyses were conducted. Studies of health intervention most commonly performed cost effectiveness analyses, followed by cost utility analyses. The food and agriculture sector relied primarily on cost utility analyses and benefit cost analyses. Social protection studies mainly were cost effectiveness analyses, followed by benefit cost and cost utility analyses. 11 studies conducted more than one type of economic analysis. 5 of these included both cost effectiveness and cost utility analyses, whereby illnesses averted or cured were converted to DALYs or QALYs averted, and 6 placed a monetary value on either illness or DALYs averted using benefit cost analysis. This is a table summarizing the benefits that were included in ratios by sector. There's a lot of information here, but let's focus on a few summary points. The most common benefit was the improvement of nutrition status at 56% of all ratios, but this varied by sector. 72% of health sector ratios, 71% of multisectoral ratios, and 56% of food agriculture ratios included this benefit type, while only 31% of social protection ratios and 7% of WASH ratios did so. Health improvements that were not related to nutrition, such as malaria and HIV, were included in 9% of the health sector ratios and 18% of multisectoral ratios, but in none of the ratios assessing food and agriculture, social protection, or WASH interventions. WASH ratios, when they captured any benefits resulting from health improvements, instead tended to either monetize them, to measure the productivity gain resulting from improved health, and or assess beneficiaries' out-of-pocket costs or indirect costs, such as lost days of work from illness. And this reflects the high number of benefit cost analyses conducted within the sector. Notably, only around 1/3 of all ratios considered cost savings of any kind. For instance, 47% of benefit cost ratios included beneficiary cost savings, compared to 12% of cost effectiveness and 13% of cost utility analysis ratios. Finally, with the exception of WASH sector evaluations, the inclusion of benefits unrelated to nutrition was relatively rare. So other sectors could consider expanding the range of benefits beyond nutrition and conduct benefit cost analyses rather than cost utility or cost effectiveness analyses if their benefits are diverse and can be monetized. There also is scope for more studies to include cognitive, education, or productivity gains associated with investments in nutrition. Looking at some of the broader trends, we found that the majority of studies focused on a narrow band of nutrition outcomes, namely wasting, stunting, diarrhea, anemia, and vitamin A deficiency. These were for nutritional status improvements as measured by anthropometric assessment, morbidity, mortality, and measurement of DALYs. While these outcomes are certainly pertinent to the sector, they're focused on to the exclusion of other outcomes. Finally, very few studies included more than 1 or 2 benefits. We concluded from this that the economic evidence base so far is pretty limited, and given the wide variety of benefits that come from multisectoral nutrition programs, there is work to be done in expanding the potential for economic evaluations to include more of these benefits, so that we can better understand the true economic value of multisectoral nutrition programs. A few conclusions come from this work, and I encourage you to read the full paper when it is published to learn more. First, the sector that the intervention comes from is strongly related to what type of evaluation is conducted and which benefits are included. Health sector and multisectoral evaluations tended to focus on nutrition status improvements and conduct cost effectiveness analyses and cost utility analyses. Other sectors were more mixed in which benefits to include, and with the exception of social protection, conducted benefit cost analyses more often. We propose that more economic evaluations should be conducted on non-health sector interventions and on multisectoral interventions, as economic evidence here is limited so far. Regardless of sector, there are several benefits that are often omitted, including women's empowerment and mental or social benefits. Some of these gaps in the existing evidence are due to practical or methodological challenges in benefit measurement, such as placing a monetary value on benefits that do not have a market value. These are intractable challenges that will require future research to advance methods for measurement and quantification. Finally, one current evidence gap that should be easier to fill is that we noted that cost savings are not usually included in economic evaluations. These can be an important benefit of nutrition interventions and can be included in any type of economic evaluation. So it should be feasible to include these benefits in more evaluations in the future. That's it for me. Thanks a lot for listening.